All right. First thing you do, hold the heart in anatomical position. And in anatomical position, let's see, it's much more like this. Okay? Then you know right and left. You know anterior and posterior. So, we have a right atria, a right ventricle, a left atria, a left ventricle. Blood comes into the right atria through the superior and inferior vena cava and in through the coronary sinus or coronary great cardiac vein. It then is going to go through the right AV valve, we call that the tricuspid, past the chorda tendinei, past the papillary muscle, through the trabecular carne so that blood fills up this whole thing. At a given signal coming from the SA node, the atria are going to contract. A wave of contraction is going to go across the atria, but not across the ventricles because of the atrioventricular septum, which is CT and going to stop it. In order to get the signal to continue, we have the AV node, which penetrates the septum and becomes the bundle of His, the left and right bundle branches, which come all the way around and then give off further branches, which are called the Purkinje fibers. The atria relax, the ventricles contract, and blood is forced out of the ventricles on the right side through the pulmonic valves and into the pulmonic trunk, continuing along the pulmonic trunk into the pulmonic arteries. Arteries are away from the heart. Throughout the lungs, coming back to the heart through pulmonic veins, towards the heart through veins, into the left atria, through the left AV valve, which is the mitral valve, past the chorda tendinei, past the papillary muscle, through the trabecular carne, filling up. Blood will be expelled through the semilunar valve of the aorta or the aortic valve into the ascending aorta, the arch of the aorta, and finally the descending aorta. First two branches off of the ascending aorta are the left and right coronary arteries. They continue as left. You can see a little bit right coronary artery. And where they start to branch is where we start to name other arteries. This is going, the left coronary artery is going to give rise to the anterior interventricular and the circumflex, C-shaped, and the right coronary artery is going to give rise to the marginal and then the posterior interventricular artery. Arteries continue breaking down until they become capillaries. Capillaries return to venules. Venules become veins and go back to the great cardiac vein or the cardiac sinus where they enter into the right atria once again.
Excellent.